Hi, my name is Marissa Murphy. I'm a senior at Dominican College, and my honors project is exploring the impact of COVID-19 on intimate partner violence. With over 10 million people experiencing domestic violence each year, along with the number of intimate partner victimizations increasing by 42% from 2016 to 2018, IPV is a very present and real issue threatening families everywhere. With millions of people being trapped at home and the presence of heightened feelings of stress due to a plethora of different factors sparked by the COVID-19 pandemic, there is a serious threat to the welfare and safety of victims who are living in homes with a history of IPV. This poster presentation will explore the impact of the current pandemic on IPV victimization and related victim services. What is intimate partner violence, you may ask? Intimate partner violence is known as IPV, is a form of domestic violence by a current or former partner or spouse that are in an intimate type of relationship against the other spouse or partner. This abuse can be made up of stalking, psychological, sexual, and/or physical violence, and can also be classified as economic and verbal abuse as well. 1 in 4 women and 1 in 10 men suffer from IPV each year. Factors that are contributing to increased IPV incidents during the pandemic are things like unemployment, restrictions of freedom, virtual learning challenges, worsening mental health issues, and alcohol and substance abuse are all things that are contributing to an increase in IPV incidents, along with posing a serious threat to the welfare and safety of victims who are living within a home that has a history of IPV. These conditions can also lead to the stimulation of violence in homes that had not previously experienced IPV before the pandemic. There has been multiple new programs implemented since the pandemic started and IPV cases began to rise. The New York State Office of Victim Services launched a new online community for OVS-funded victim assistance programs, which are referred to as VAPs, and this service is built as a member-based online forum and provides a safe space for VAPs to come together and share valuable info and the best type of practices that they found worked for their victims. This website has forums where these who work with victims can share ideas and discuss how programs are coping with the impact of COVID-19. While I am still in the process of researching and have yet to conduct interviews with those in victim resources, during my research, I found the website, thehotline.org, had implemented safety tools onto their website to warn victims about the possibility of their web history being tracked. They remind you to clear your history or give you a number to call as well. There is also an X you can click on the site that allows you to leave the site safely, along with another reminder to regularly clear browser history. They also have a chat live now button in case the victim cannot physically speak on the phone and can only text. My findings from my research so far have shown that around the world, we are seeing an increase in domestic violence reports. France has seen a 30% increase, along with a 33% increase in Singapore. In the US, there's limited data, but there have been anecdotal reports of the increase. The Portland Police Bureau found a 22% increase in domestic violence related arrests following stay-at-home orders. The New York City Police Department also responded to a 10% increase in domestic violence reports. Overall, the evidence is there about how victims are experiencing heightened levels of violence, but since the pandemic is still ongoing, it is hard to find out exactly how much it has increased by. There have also been decreased capacities in shelters, making it even more difficult for those who are attempting to leave their abuser. It also has been shown to be extremely difficult for those who are transgender to obtain spots within shelters, preventing them from having a place to stay if they themselves are fleeing from an abusive partner. Through my research, I believe that for my recommendations and conclusions, victim services need to continue to evolve their ways of reaching victims even further, and also develop a plan in case situations like these that arose in the pandemic take place in the future. As stated previously, while my research is still ongoing, I believe that it is the best interest of victims of IPV if victim services continue to extend their services to be more accessible to those in unique situation. It is more likely than not that a victim is trapped at home with their abuser, and with lockdown orders, there is limited access to the outside. If an attempt to get help is made, the victim and the agency must be discreet, as the consequences for themselves and possibly children that may be involved could be extremely dangerous and even deadly. Also, I just wanted to share this graphic, which I got from unwomen.org. I thought it does an amazing job at showing the immense impact the pandemic has had on victims all around the world, like a 25% increase in Argentina, and the stress these rising cases is putting on victim services and the health systems in general. You can also see that the global cost of violence against women had previously been estimated at approximately 1.5 trillion. And like the poster says, it can only be found to be rising as violence has increased. Thank you for listening to my presentation, and I hope you are more informed about the risk of IPV. Thank you.